Hello, everyone, and welcome. You are watching Eagle News America. I'm Ace Ramirez, coming to you from Washington, D.C. It's Wednesday evening here, July 21st, 2021. Tonight, we have updates from our correspondents across America. For tonight's live reports, we have May Ann Manzano Guerzon in Sicklerville, New Jersey, reporting about New Jersey to provide $135 million in small business relief. Milo Simbulan in Swarthmore, Pennsylvania.
Safety tips for children not yet eligible to receive COVID-19 vaccine and their families.
Rani Bayuga in Parisburg, Ohio.
Ohio warns about Delta variant as cases surge.
Melanor Tanhueco reports about New York downscaling mass vaccination sites to focus on communities with low vaccination rates. Don Omar Cuevas in Arkansas reports about the surge of COVID cases and how the governor is imploring people to get vaccinated. For EBC Sports, EJ Gonzalez reports about the Milwaukee Bucks winning Game 6 and claiming their first NBA title since 1971. And for tonight's roundtable, let's talk about interesting facts and delicious recipes because today is World Mango Day. Coverage begins now. Amnesty International is calling for an immediate and global moratorium on the transfer of surveillance technologies following the revelations of the list of 50,000 potential targets of the Pegasus software used by some states to spy on public figures, including heads of state, humanitarians, and journalists. Katia Roux, freedom advocate at Amnesty International France, says the global investigation that was conducted by the consortium of journalists Forbidden Stories in connection with Amnesty International reveals that client governments of the Israeli cyber surveillance company NSO have been using Pegasus spyware to target and spy on people who are human rights defenders, journalists, or political figures from civil society. She says a number of lawsuits have been filed, notably by the victims of the attacks, and that Amnesty International is simply calling for an immediate worldwide moratorium on the transfer of surveillance technology, that is to say, suspending this type of transfer immediately until an international regulatory framework is established that respects human rights. Reporters Without Borders urges Israel to suspend exports of spying technology amid allegations it was used to target more than a dozen heads of state and hundreds of journalists. The list contains numbers for 14 heads of state, including French President Emmanuel Macron and Morocco's King Mohammed VI. NSO's flagship program, Pegasus, can hack into mobile phones without users knowing, enabling clients to read every message, track a user's location, and tap into phones' cameras and microphones. In other news, Chancellor Angela Merkel's cabinet approves a huge emergency aid package for flood-stricken regions of Germany and says billions would be needed to rebuild homes, businesses, and vital infrastructure. A week into the region's worst flooding disaster in living memory, which has killed at least 170 in Germany and 201 in total in Europe, the right-left Grand Coalition government unblocks some 400 million euros or $470 million in immediate relief. Finance Minister Olaf Scholz says half will come from the federal government of Europe's top economy and the rest from the 16 regional states. He said it has to be made sure that life can go on and that the coming months would bring a billion-strong reconstruction program to clear the devastation and restore infrastructure, including roads, bridges, and railways. Merkel has vowed on a visit to the badly hit medieval town of Bad Münsterfeld that Berlin would come through to help in the short and long term. She says her government would do everything in its power so that the money is with people fast. The regional government in Belgium's hard-hit Wallonia pledges a total of 2 billion euros in reconstruction aid after what it called unprecedented destruction from the floods. Meanwhile, Beijing says climate cooperation with Washington will depend on the overall strength of the Sino-US relations after America's climate czar John Kerry urged China to curb emissions quickly. Chinese Foreign Ministry spokesman Zhao Lijian warned that cooperation on environmental issues could be affected by deteriorating Sino-US relations. He says the United States should not want to interfere in China's internal affairs to the detriment of China's interests, while demanding China's understanding and support in bilateral and global affairs. Tensions between China and the United States have soared in recent months, with the two sides trading barbs on Beijing's human rights record and its initial handling of the coronavirus. Tackling climate change is among a handful of issues where the two sides had agreed to work together. Kerry calls on Chinese policymakers to ensure emissions peak before the target deadline in 2030, since it was the only way to break free from the world's current mutual suicide pact. Now for today's COVID-related news, Tunisia's government stumbles deeper into crisis over its handling of the coronavirus pandemic after Premier Ichem Mekichi fires the health minister and amid skyrocketing cases in the North African country. Mekichi, whose office announced Fauzi Medi's sacking on Tuesday evening, slams the minister's performance, pinpointing oxygen shortages at Tunisian hospitals and a slow rollout of vaccines. He says there's an extraordinary level of dysfunction at the head of the health ministry. Tunisia has been overwhelmed by COVID-19 cases, including nearly 18,000 people who have died in a country of around 12 million. Hospitals have faced acute shortages of oxygen, staff, and intensive care beds, and fewer than 8% of the population are fully vaccinated. Zainab Bouzaida, a volunteer doctor at the Farhat Hatched Hospital in Sousse, says doctors are losing hope in the whole Tunisian health system, but are there for patients. He says after this pandemic, there will be huge repercussions. There are people who will leave and those who will give up. But now they are trying to hold on just for the sake of the patients. Daid Mezgar, head of emergency of the same hospital, says the situation is fragile and unstable. He says health workers are holding up but are at risk of burning out with lack of human resources. As the metropolis faces an uptick in cases fueled by the Delta variant, Mayor Bill de Blasio says New York City will require public hospital workers to get vaccinated or take a weekly coronavirus test. The order will go into effect from August 2nd and apply to the some 30,000 employees in the city's 11 public hospitals.
All of our health and hospitals staff, all of our clinical workers for Department of Health, it's very clear, and the Health Commissioner will explain the order he is issuing to put this into effect. Every single one of those employees has a choice. Get vaccinated, the better choice, or get tested weekly. And at any point, you can decide, hey, I'm ready to get vaccinated, then you don't need to get tested weekly anymore. This is about keeping people safe and stopping the Delta variant. If we want,
the requirement is the most stringent measure taken in the U.S. megacity, where nearly 58% of the population has had at least one dose of a vaccine against COVID-19, a figure reached through a vaccination campaign based on voluntary participation and incentives. While healthcare workers retain the option of being tested for the coronavirus weekly in place of getting vaccinated, de Blasio says he was confident people would choose to get a shot. The announcement comes as controversy builds in the United States over what steps should be taken to increase vaccination rates against the Delta variant, which, according to recent estimates, accounts for 83% of U.S. infections. Many health officials are pushing to make vaccination mandatory, at least for certain segments of the population. But several Republican-led states have instead passed laws banning coercive measures, particularly in schools. More news from New York in a bit. A government study suggests up to two-thirds of India's population may have been infected with COVID-19. Balram Bhargava, chief of the Indian Council of Medical Research, or ICMR, says the blood serum survey of about 29,000 people in June and July shows 67.6% of those tested had antibodies.
Here we have this number, that is the overall seroprevalence is 67.6% in the entire population, which is from 6 years and adults included. In conclusion, two-thirds of the general population, that is above the age of 6 years, had SARS-CoV-2 infection. More importantly, a third of the population did not have any antibodies. That is still approximately 40 crore population of this country is still vulnerable. So the implications of this large serosurvey done as round number 4 clearly show that there is a ray of hope. But there is no room for complacency. We must maintain COVID-appropriate behavior and community engagement.
The results of the study by the Indian Council of Medical Research, or ICMR, show the impact of a devastating surge of cases in April and May, when India reported about 400,000 cases and 4,000 deaths per day. In December and January, less than 25% of those in a similar study had positive antibody tests. The hundreds of millions in India without antibodies are more susceptible to severe infection. Only 13% of the adults in the study were fully vaccinated. India, home to 1.3 billion people, has only vaccinated about 8% of eligible adults, triggering fears of an imminent wave of cases as it eases COVID curbs. India's official COVID death toll of 418,480 is the world's third highest after the United States' 609,000. Fatalities in Brazil's 554,000. But a U.S. research group report estimates that the actual death toll could be up to 10 times higher, citing the number of extra people who died compared with pre-crisis figures. In a release by the National Institutes of Health, or NIH, a study published in The Lancet shows that more than 1.5 million children around the world are estimated to have lost at least one parent, custodial grandparent, or grandparent who lived with them due to death related to COVID-19 during the first 14 months of the pandemic. The study highlights orphanhood as an urgent and overlooked consequence of the pandemic and emphasizes that providing evidence-based psychosocial and economic support to children who have lost a caregiver must be a key part of responding to the pandemic. In the paper, COVID-19 associated deaths referred to the combination of deaths caused directly by COVID-19 and those caused indirectly by other associated causes, such as lockdowns, restrictions on gatherings and movement, decreased access or acceptability of healthcare, and of treatment for chronic diseases. The countries with the highest numbers of children who lost primary caregivers, parents or custodial grandparents, include South Africa, Peru, United States, India, Brazil, and Mexico. The countries with rates of COVID-19 associated deaths among primary caregivers include Peru, South Africa, Mexico, Brazil, Colombia, Iran, United States, Argentina, and Russia. The study finds that for every country, COVID-19 associated deaths are greater in men than women, particularly in middle and older ages. Overall, there are up to 5 times more children who have lost a father than who have lost a mother. For today's COVID-19 numbers, according to the Coronavirus Resource Center of Johns Hopkins University in Medicine, as of 6 p.m. Eastern Time, Wednesday, July 21st, the number of cases of COVID-19 reported worldwide is now over 191,739,000. Top 3 on the list of countries with recorded cases: U.S. with more than 34.1 million, India more than 31.2 million, Brazil with more than 19.4 million. This virus has now claimed more than 4,122,000 lives worldwide. Top three countries with the most number of COVID-19 related deaths are US with over 609,000, Brazil with over 544,000, India with over 418,000. Total vaccine doses administered worldwide are now at 3,709,089,000. Up next, updates from New Jersey and Pennsylvania. Eagle News America will return in a moment. Stay with us.
Events happen around us all the time, in our community, in our country, around the world. Events that affect people, move communities, or simply inspire us. Interesting events that people need to know. In these interesting times, we continue to be a competent partner in delivering news about these events. Fast, accurate, balanced. Eagle News, because we live in interesting times.
Hey there, Arnie Aquino here at Hatley Castle, one of the filming locations for the X-Men series. Don't forget to tune in to Digital Nest only on Net 25.
Welcome back. You are watching Eagle News America. In New Jersey, there's additional aid to benefit small business owners impacted by the pandemic. As these local shops and establishments reopen and try to bounce back, the state is granting them $135 million in relief funds. To tell us more, Eagle News correspondent Mayanne Manzano-Guerzon joins us tonight. Mayanne.
Thank you, Ace. More than $700 million in direct small business relief since the start of the pandemic. Governor Phil Murphy today signed legislation providing additional aid to small businesses as New Jersey continues to provide support to small businesses as they recover from the pandemic. The bill provides $135 million to small businesses throughout the state. New Jersey Economic Development Authority Chief Executive Officer Tim Sullivan said that supporting small businesses is a central component of New Jersey's plan for a stronger, fairer recovery from the COVID-19 pandemic. He also said that the $135 million in additional COVID-19 relief funding will be a lifeline to small businesses as they reopen and return to full capacity. Senator Linda Greenstein, one of the sponsors of the bill, said that over the past year, many small businesses have had to make the unfortunate decision to close down permanently due to the COVID-19 pandemic. Thus, it is imperative to aid the surviving businesses and provide opportunities for new businesses to prosper. The breakdown of the $135 billion in today's legislation is as follows. For micro businesses, $55 million. Bars and restaurants, $15 million. Childcare facilities, $10 million. For-profit arts and culture organizations, $10 million, and eligible small businesses and nonprofit organizations, $45 million. For your COVID-19 numbers, Ace, New Jersey's latest COVID-19 is the Department of Health has reported another 655 new positive cases today, bringing our statewide total to 899,464. Sadly, we are also reporting 5 new confirmed deaths, pushing the total to 23,844 COVID fatalities. But on the brighter side, the latest total of fully vaccinated individuals in New Jersey is now 5,185,731. And to know the latest on New Jersey's vaccination progress, visit covid19.nj.gov/vaccine. And Ace, for a quick weather update, it's partly cloudy here in New Jersey. It was raining with thunderstorm earlier today. It is 72 degrees Fahrenheit, or 22 degrees Celsius. In Sicklerville, New Jersey, May and Manzano Garzon, Eagle News, we live in interesting times. Back to Ace.
Thank you, May Ann. I understand Senator Greenstein is one of the sponsors of the bill. Who else sponsored the bill?
Right, Ace. So in the Senate, the bill was sponsored by Senators Don Maria Diego and, yes, you mentioned Linda Greenstein. And in the Assembly, the bill was sponsored by Assembly members Gordon Johnson, Vince Mazzeo, and Andrew Zwicker. Ace?
I see. And who will administer the funding?
Ace, the bulk of the funding will be administered by the New Jersey Economic Development Authority and will help fund all of the eligible Phase 4 applications, because there were a lot of applications during the Phase 4 of this funding. And to date, Ace, just to add information, the Economic Development Authority has allocated more than $650 million in aid to tens of thousands of small businesses here in New Jersey. Ace?
I bet this is like a lifesaver for businesses. I bet there's a big surge in applications. Thank you so much, May Ann Manzano Gorzon, Sicklerville, New Jersey.
Thank you, Ace.
Do you or someone you know belong to a household with both vaccinated and unvaccinated kids? Thinking of ways to slowly but safely get them back to school without missing any safety precautions? Bureau Chief Miles Bullen tells us how Pennsylvania is reaching out to children and their parents to provide COVID safety tips as schools are set to resume this fall. Myla.
That's right, Ace. So the Department of Human Services, or DHS, Acting Secretary Meg Sneed and Acting Physician General Dr. Denise Johnson visited the Whitaker Center in Harrisburg today to discuss recommendations to keep children and their families safe while children under the age of 12 are not yet eligible for COVID-19 vaccine. Take a look.
As adults and older children continue to get vaccinated, many parents have questions about what activities are safe for them to do with their children. So today we want to provide some guidance and advice to families so they can enjoy the summer activities as safely and confidently as they can. And while the statewide mask mandate has been lifted, it's important that we continue to take steps to keep ourselves, our children, our families, and friends safe. The FDA currently authorizes the use of the Pfizer vaccine for individuals 12 years or older. That means that at the moment, children under the age of 12 are not yet eligible for the COVID-19 vaccine. And at this time, we don't know when that vaccine will be available to these younger kids. As such, there's still a risk of COVID-19 spread among children, and please note that children, regardless of age, with underlying medical conditions may also be at increased risk of severe illness from COVID-19 compared to other kids. As a mom to 2 young girls, I want my girls to have an enjoyable summer, but I know and understand that although life is starting to get back to normal, COVID-19 is still spreading. So I want them to have fun, but I also need them to be safe.
DHS and its Office of Child Development and Early Learning, or OCDEL, along with the Department of Health, follow guidance from the Center for Disease Control and Prevention, or CDC. The CDC recommends that children under the age of 2 should not wear face coverings. Children between the ages of 2 and 12 and older children who are not yet vaccinated, however, are strongly encouraged to continue wearing face coverings in public settings, at events and gatherings, and anywhere indoors when they will be around other people outside of their household. If a child is unable to wear a face covering, the CDC recommends more low-risk activities, such as enjoying activities outdoors with members of their household or attending a small outdoor gathering with fully vaccinated family and friends. Risk of COVID-19 infection increases if unvaccinated children gather from multiple households. Therefore, the safest place to visit is outdoors. Children with underlying medical conditions, regardless of age, may also be at increased risk of severe illness from COVID-19 compared to other children. So continued use of face coverings are encouraged to help protect unvaccinated children. Indoor activities can occur so long as all people involved take safety precautions, including wearing a face covering that fits snugly, staying distance from others, and visiting in a well ventilated space. This includes visiting with fully vaccinated grandparents without wearing face coverings or physical distancing, provided none of the unvaccinated family members are at risk of severe COVID 19. These precautions, regardless of a child's age or vaccination status, should be applied along with washing your hands with soap and water for 20 seconds, making sure your child covers their mouth and nose with a tissue when coughing or sneezing, staying home if you're unvaccinated and sick with tested positive for or were recently or within 14 days exposed to COVID 19, and continuing routine doctor appointments and vaccine visits. Any person, regardless of vaccination status, experiencing new or unexplained symptoms of COVID 19 still needs to isolate and be evaluated for COVID 19. Children 12 or older and the adults who have not yet received their COVID 19 vaccine are strongly encouraged to get vaccinated as soon as possible to protect themselves and their loved ones. As for the weather here in Swarthmore, it's 72 degrees Fahrenheit or 22 degrees Celsius with partly cloudy skies. In Swarthmore, Pennsylvania, Mila Simbul and Eagle News, we live in interesting times. Back to you, Ace.
Thank you, Myla. So, is Pennsylvania ready to reopen schools, especially for those unvaccinated 12 years old and under?
Yes, it is ready. Actually, they will reopen the schools even though some of the kids are not vaccinated. In the school district where I'm in right now, you still have an option of going online, full online. But I haven't heard of if there is a choice of hybrid where you go a couple of days online and then a couple of days in person. So yeah, some of the school districts here have a combination. There are different rules again, just like last year. So we will see because we have all these variants coming in. So I remember last year, every month there's a new rule or new guidance that's coming in. So we might expect the same thing this year as well. Ace?
Are your kids all vaccinated already?
No, they're not. Two of my kids, my 12-year-old and my 15-year-old, they're both vaccinated, but I still have a 10-year-old. So yes. So we're in the same position where, yeah.
Okay, so that 10-year-old, what precautions are you taking since the school's reopening?
So he's going in person. Last year he was full online, but we're planning to put him on in person because he's been here at home for such a long time. We want him to be with his friends and his classmates, be with other kids as well. But during this summer, he's been wearing his mask all the time. I've been telling him, especially when they're indoor. But outdoors, I let him go with his friends and play outside without mask. But yeah, whenever we're indoor, even us, my family and I, when we're outside, we are wearing a mask as well, so that we prevent him from getting infected as well. So it's kind of challenge though, having one kid at home who's not yet vaccinated.
I agree. Keep the safety precautions instead of being sorry later on. Thank you so much, Myla Simbulan, Swarthmore, Pennsylvania. When we come back, updates from Ohio, New York, and Arkansas. Eagle News America, we'll be right back.
Innovation, digital disruption, globalization, startups, micro, small, and medium enterprises, as well as large corporations, all face interesting challenges in the market today. Peek into the world of exciting opportunities and partnerships to drive growth with the latest business news and information. We are open for business. your weekly dose of entrepreneurial inspiration to update you on the latest developments in the world of business. Get up close and personal with CEOs and thought leaders to help you discover valuable insights, sharpen your instincts for smart decision making with the latest markets and economic trends, disruptive ideas, global innovation, social entrepreneurship, and other leading-edge business ideas. Join the conversations to create a more vibrant environment for entrepreneurship. Catch Open for Business, from vision to action.
Welcome back. You're watching Eagle News America. In Ohio, state health officials are redoubling efforts to encourage non-vaccinated Ohioans to get the COVID jab as cases of the Delta variant surge. Joining us tonight is Eagle News correspondent Rani Bayuga with more on the story. Rani.
Thank you, Ace. Dr. Bruce Vanderhoff led a press conference today to talk about COVID-19 Delta variant and vaccinations. The Delta variant seems to be escalating in Ohio. Significant changes are being noted in the trends, as Dr. Bruce explains. Let's take a look.
So much, and good morning. I want to begin with some perspective on COVID-19 across the state. After a long period of decline, the COVID-19 cases are now steadily rising again in Ohio. For example, after reaching a low of 17.6 on July 7th, our two-week average of cases per 100,000 have more than doubled to 37.8. And our concurrent hospitalizations have jumped from 200 on July 9th to 348 July 20th. And yesterday, we reported an increase of 744 cases in just 24 hours. It appears that this surge is being driven by yet another variant, the Delta variant, which is, as I've shared before, even more contagious than the B.1.1.7 or Alpha variant that preceded it. Indeed, looking at our most recent two-week snapshot of genomic sequencing data, it would appear that as of July 3rd, the Delta variant was present in more than 36% of our detections. That's up from 15% in the first half of June and less than 1% in late July. And all indications are that our next two-week data for the period from July 4th through July 17th will confirm that Delta is fast becoming the dominant variant in Ohio.
The press conference also touched on vaccinations for children. Dr. Vanderhoff asked questions to Dr. Patty Manning Courtney of Cincinnati Children's Hospital on the efficacy of COVID-19 vaccine on children.
Well, thank you. Are there any other unique needs children and youth have when it comes to being vaccinated? 19 vaccines, and are they something that parents should be worried?
Dr. Vanderhoff, we've been very fortunate to be directly involved in the vaccine trials, which started in children actually last fall. Last November, we began recruiting 16 and 17-year-olds, followed by 12 to 15-year-olds, followed by children under 11, and is down to as young as 2 last spring. So we've had great experience firsthand seeing children participate in these trials. And we've learned a lot that children both benefit from these vaccines, they tolerate the vaccines. You know, the way that a vaccine trial works is that one group of individuals, children or adults, get the vaccine and another don't. They get a placebo. And then we watch both for side effects as well as for development of COVID. And we've seen through those trials that children are remarkably and wonderfully responsive to these vaccines. They're very well protected, and they have had very minimal side effects.
In the last week, Ohio has seen some significant number of new cases of COVID-19. Just 2 days ago, 600 was added in the last 24 hours, and As of today, 785 were added. There are now a total of 1,119,298 confirmed cases of COVID-19 and 61,325 hospitalizations, and sadly, 20,449 total deaths. Dr. Vanderhoff and the other doctors at the virtual press conference are encouraging everyone to get vaccinated. They assure that the vaccines are effective deterrent even the Delta variant. Concerns are over the non-vaccinated Ohioans, and we may see increasing trends in new cases due to non-vaccinated residents. Overall, there are now 48.6% of Ohio's population that are vaccinated. That's 5,681,055 who have received at least one shot of the vaccine. That means we have 51.4% yet to be vaccinated. It is currently partly cloudy, 23 degrees here in Perrysburg, Ohio. That's 68 degrees Fahrenheit. From Perrysburg, Ohio, Ronnie Bayuga, Eagle News. We live in interesting times. Back to you, Ace.
Thank you, Rani. Can you explain further how Dr. Vanderhoff touted the efficacy of vaccines?
So there's a lot of questions that they tried to address in their press conference today about the validity of the vaccine and how they came about bringing this vaccine so that everyone can use it. So the vaccine itself has been under study for at least 10 years, because we're going back to the SARS virus and the MERS virus back in, let's say, 2002. So they are actually from the same family that the COVID-19 comes from. COVID-19 is actually SARS-CoV. It's SARS and MERS and COVID-19 are all of the same family. So what they're saying is that the vaccine to target COVID-19 has been studied since then. So part of that is also the technology that people are questioning, the mRNA, how the vaccine is actually delivered to us. So that has actually been, research has been done on that for decades. I remember back when I was in high school, we're talking about this. When I was in college, when I took immunology, we were talking about this kind of thing. This was cutting edge back then, and we didn't, and now that it's actually come to fruition, that's actually something that's new, and it's scaring people, I guess. So they're thinking that we're mutating our DNA, but that's not really the truth about that. So they tried to address a lot of the questions that people are having regarding the vaccine itself. So that's the kind of things that they were trying to convey to everyone.
And there are still a lot of naysayers saying corners were cut in producing the vaccine, and it's that the studies were only started a couple of years ago, doubting its efficacy. So what was said about that?
Well, they did cut corners, but not in the actual process and testing of the vaccine, because what they cut corners is actually what they claim is the red tape, which is basically, all the paper pushing and trying to validate everything, taking a large amount of time. So they had that escalated. So that's the corners that they were actually stating as being cut. Now, as for the safety and use of the vaccine, they actually went through the normal process.
Thank you for clarifying that, Rani. Hopefully, a lot of people will understand that better now. Thank you, Rani Bayuga, Perrysburg, Ohio.
Thank you, Ace.
In an effort to reach more residents in areas with lower vaccination rates, New York is downscaling its mass vaccination sites and taking a more grassroots approach. Eagle News correspondent Melanor Tanweco reports.
New York Governor Andrew Cuomo announced that 4 mass vaccination sites will cease operations. This is part of the ongoing downscaling that will allow the state to focus on local vaccination efforts. The sites at Binghamton University, Aviation Mall in Queensbury, Stony Brook, Southampton, and the Diana Center at SUNY Orange will cease operations on July 26. Over the course of the coming weeks and months, the state will evaluate the remaining mass vaccination sites to determine future necessity based on demand, proximity to other vaccination sites, and other locally focused efforts. The transition reflects the state's plan to focus resources in areas where the vaccination rate is lower than the statewide average. Governor Cuomo said New Yorkers have made great progress beating back this virus, but we have to make sure everyone who's able gets vaccinated as soon as possible to defeat COVID-19 for good, especially with new, more contagious variants of the virus out there. New Yorkers are encouraged to continue to utilize the MI Eligible tool to make appointments and check on the availability of vaccines at state-run vaccination sites. All open sites continue to offer walk-in vaccinations for all eligible individuals. So far, 74% of New Yorkers age 18 and older have received at least one vaccine dose, with 67.5% completing the vaccine series. In Rochester, New York, Melanor Tanweco, Eagle News. We live in interesting times. Back to you.
Governor Asa Hutchinson implores Arkansas residents to get vaccinated against COVID as positive cases spike in the state. Eagle News correspondent Don Omar Cuevas reports.
Hello, this is Don Omar Cuevas reporting from Little Rock, Arkansas. Thank you for having me. In the state of Arkansas, there are now 367 total cases of COVID-19, with about 350,000 recoveries and 6,000 deaths as of the 20th of July. Recently, there's been another surge in COVID cases in Arkansas, which is not only concerning to many citizens, but also to the governor, Mr. Asa Hutchinson. He stated that this is a trend that must be turned around. The University of Arkansas for Medical Sciences, also known as UAMS, shared some grim insight regarding the recent surge in a report from the 20th, likening COVID to a raging forest fire that will grow in size and strength. One way that you can help reduce the spread is by getting vaccinated if you haven't already. As of now, the vaccine plan still allows Arkansans aged 12 and older to receive the vaccine. With the vaccine being so accessible to Arkansans at this point, we should all be encouraged to get vaccinated. Of the nearly 2.8 million doses of the COVID vaccine in Arkansas, only about 2.25 million doses have been given. Let's do what we can to raise that number. The unemployment rate in Arkansas has stayed at 4.4% for the past 3 months, according to information from the U.S. Department of Labor. This is much lower than the 5.9% national average, which has even increased from 5.8% over the past month. According to the governor, the shortage of workers reflects a hesitancy of some to return to the workforce. But as recovery from the pandemic progresses and federal stimulus slows down, the hesitancy should diminish. In other news regarding the governor, it was announced on the 8th of July that Governor Hutchinson has been selected as the new chair of the National Governors Association. As for his plans as the new chair, he has stated that his main initiative will be to improve access to computer science education nationwide, as Arkansas is well known for its computer science education program, and the governor would like to expand that. In addition, Governor Hutchinson plans to help facilitate the state's partnership with the White House in dealing with both the pandemic and any fears people may have of the vaccine. As always, thank you for having me, and stay safe. Don't let the recent surge in the virus stop you from doing what you can to combat it. In Little Rock, Arkansas, Don Omar Cuevas, Eagle News. We live in interesting times. Back to you in the studio.
Up next, EBC Sports and tonight's roundtable discussion about World Mango Day. Eagle News America will return shortly. Welcome back. This is Eagle News America. It's been a long time coming, but the Milwaukee Bucks and MVP Giannis Antetokounmpo are now on top of the NBA world, capturing the NBA Finals in 6 games against the Phoenix Suns. With more on the story, here's EJ Gonzalez in Alexandria, Virginia.
Thanks, Ace. The NBA season is now officially over as the league crowned a new champion last night. The Milwaukee Bucks were able to close out the series against the Phoenix Suns in 6 games and have won their first NBA championship in 50 years. This series opened up with 2 wins at home by the Phoenix Suns, and then Milwaukee squared up the series 2-2 as they took care of business at home. Then in the pivotal Game 5, the Bucks were able to steal a win on the road and gave themselves the opportunity to close out the series on their home court. Now, historically, the team that wins Game 5 in the NBA Finals has gone to win the title over 72% of the time. Game 6 was a battle that featured 7 ties and 6 lead changes throughout the game. The Bucks led by as many as 13 points in the first quarter, but the Suns made their routine rally to take a lead going into halftime. Then, by the end of the third quarter, the game was tied 77-77. Just 1 quarter separated the hopes of Phoenix either forcing a Game 7 back home or the Bucks being crowned as champions. In the end, the Larry O'Brien Trophy was handed that evening to the Milwaukee Bucks, who won the game 105-98. The Bucks were led by Giannis Antetokounmpo's historic NBA Finals performance of 50 points, 14 rebounds, and 5 blocks. This was his 3rd game with at least 40 points and 10 rebounds, and finished the NBA Finals with an average of 35.2 points, 13.2 rebounds, and 5 assists per game, with a 61.8 field goal percentage. The one weakness critics were pinpointing all playoff long was his free throw shooting, which stood at just 55.6%. But Giannis even corrected that in the most pivotal game of his life and shot 17 of 19 from the line to close out the series. Rightfully so, Giannis Antetokounmpo was named the NBA Finals MVP. In his MVP speech, what did the Greek Freak say? That he was not only happy to get it done with this group of guys, especially Chris Middleton, who he was drafted together with by the Milwaukee Bucks 8 years ago, but he's ready to do it again. In Giannis-like fashion, this morning the MVP went on Instagram Live and featured himself interacting with fans while in line to get some breakfast. In his lap sat the Larry O'Brien Trophy and Finals MVP trophy. Now, being the friendly guy that we know Giannis to be, he rolled down his window to take pics with the fans and even let one lucky guy touch the trophy. He celebrated his 50-point performance with an order where he specifically requested not 51, not 49, but 50-piece mini chicken sandwiches. Congratulations to Giannis Antetokounmpo and the Milwaukee Bucks. In Alexandria, Virginia, EJ Gonzalez, Eagle News, we live in interesting times. Back to you, Ace.
July 22 is World Mango Day. Let's talk about fun facts about mangoes. According to mango.org, the most popular fruit in the world is not apples. It's mango. It's in season all year long. A lot of people will probably contest this, but it is in season all year long. A mango serving of 3/4 of a cup is just 70 calories, so that's good news for those calorie watchers. And it contains 20 different vitamins, 50% of your daily vitamin C, 8% of your daily vitamin A, and 8% of your daily vitamin B6. Other fun facts from justfunfacts.com. It's mango is native to South Asian areas of India, Burma, and the Andaman Islands. It has over 400 varieties, and the mango tree grows to 115 to 130 feet tall. Trees are long-lived. Some still fruit after 300 years. So long before we're gone, it's still bearing fruits. It is the national fruit of India, Pakistan, and the Philippines. Okay, let's ask our team members. Any fun facts? Let's start with the only thorn among the roses. Rani, all right. Okay, how do you like your mangoes? Ripe or
green? I love them green.
All right. What kind of dip?
Oh, it's gotta be that shrimp paste that we use in the Philippines.
Oh, the one they call bagoong.
Yeah, the pink one. Yeah, I like that one with a little bit of sili. Yeah, that's perfect.
I can already see May Ann with her big grin. She's probably salivating listening to bagoong. May Ann, okay, how do you like your mangoes?
Well, Ace, I'm laughing because I'm the total opposite. I like it ripe, and for some reason I don't like it green with alamang or suka or salt. I just don't like it like that. So it's always ripe, and I like it sweet.
Who doesn't like mangoes? The green mangoes,
it's too sour. I think I have a very low tolerance to anything sour.
Okay, let's hear it from Myla. Myla, how about you? Green or ripe?
I like it both. Green mango shake. Woohoo! I love green mango
there
shake.
You go.
Yes, so the sour, you can make it sweet, Mayan. So yeah, don't worry about that. You can put a lot of sugar on it and ice, and then you have green mango shake. And I don't know if you've heard of Thai mango sticky rice. It's one of my favorite recipe also.
Mm-hmm.
With mangoes, I love it, and it only has a few ingredients: sticky rice or sweet rice, coconut milk, sugar, and then that's it. You just cook it. And what I do is I don't put the coconut milk on the sticky rice. It's on the side. The coconut milk, the sugar, and then just pour it with the mango, and it's really good. It's amazing.
Oh.
Yeah.
Okay, you guys talked about smoothies. Have you tried the green mango smoothie?
I haven't, but the ripe one.
The ripe one with some yogurt.
Not a big fan, but there it's
between smoothie and shake. I've tried the green mango shake. Isn't that? I think it's the same.
I think it's about the same. It has ice, has milk, sugar, and green mangoes.
So.
Well, they have the same ingredients. They just
but the green one's a little more tart, right? It's just it's great that way.
Right.
Yeah.
Well, okay. Share your fun mango facts with us if you have any. Myla, let's start with you.
So India, did you know that India grows more mangoes than all its other fruits combined? That's how much they grow mangoes in India. Yes.
So they're the biggest producer of mangoes. That's very interesting. Rani,
go to the store. I can see all those my neighbors are Indians who always grab all those mangoes from the store because they love mangoes. I thought we're the only ones who love mangoes, but I didn't know that. Yeah, all those from India, they love mangoes as well.
Mm-hmm. How about you, Rani? Okay, fun facts.
Did you know that mangoes are fat-free, sodium-free, and cholesterol-free? Fun fact. It's really good for you.
Oh,
That's too healthy.
And that's why I put shrimp paste.
All right, there you go. The balance is there. Mayan, okay, share with us your fun facts about mango.
I have two A's. So one, mango seeds are used to make soap due to its high stearic acid content. Second, the paisley pattern that we all love, maybe in the older times, developed in India is based on the shape of a mango, the paisley patterns. And that's very cool to know. Ace.
Oh, that's a cool fact. Okay, you mentioned something about acidity. That is another fun fact about mangoes because although mangoes are often served, chilled, right? In some areas, they serve it chilled over ice. But did you know that mangoes, if you eat it, it's warm. It makes your body warm. So eat a lot of mangoes and it will make your body warm. It's because of the acidity. And did you know that the sweetest mango in the world can be found in the Philippines?
Yay! I guess
1995 in the Guinness Book of World Records, it's the Carabao mango that was recorded as the sweetest mango in the world.
The best mango.
Are those the one from Guimaras? A shout out to Kuya Delnard in the
Yeah, Kuya Del was saying something about Guimaras. Recently, I heard Guimaras mangoes are making a big hit, and even non-Filipino citizens are talking about Guimaras mangoes.
Right, it's like export quality Ace.
Right. I'm not sure if I've tried any. Have you tried the Guimaras mangoes?
Well, fortunately, most of the ones we get from the supermarkets, grocery stores here are from Mexico. It's very difficult to find those from Guimaras. I haven't had anything from here, but in the Philippines, I have tried these.
Mm-hmm. How about you guys, Myla, Rani? Have you tried the Guimaras mangoes?
I can't say I have.
How would you know? And where is Guimaras, by the way? Is it in Quezon?
We're gonna look it up, but we don't have that much time. It's
Visayas.
in the south. It's in the south of the Philippines. But that when we visit the Philippines, maybe we'll swing by Guimaras Island and try the sweetest mangoes on earth. Thank you so much, guys, for sharing. And before we end our show, we remember to thank our frontline workers, first responders, and essential workers with a bag of mangoes. No, with a round of applause, of course. That is today's Eagle News America. I'm Ace Ramirez. Thank you for joining us. We live in interesting times.